Welcome to another episode of Health Matters with PA Lynn Szabo. I'm Heather Poland, and today we have quite an interesting topic, don't we, Lynn?
Yeah, professionalism under attack. So as part of Project 2025, and apparently in the big but not beautiful bill, several important professions were deemed not to be categorized anymore as professions. And these include, and I'll just read the list, nurses, and by extension, nurse practitioners, educational majors, including master's degrees, masters and doctorates in social work, masters and doctorates in public health, near and dear to my heart, physician assistants, both master level and doctorates.
Nice.
Yeah. Occupational and physical therapy at the doctorate level, audiologists, doctorates, speech and language pathologists, business masters, engineering masters, and counseling and therapy degrees.
I wonder what all of those professions have in common.
Well, we'll get to that because there is something very interesting. But let's first look at the definition of professional in the Oxford languages. So a professional is worthy of or appropriate to a professional person, competent, skillful, and assured. Okay, so they can come across with that demeanor, but also a person engaged and qualified in a profession. So I would say it's a profession that requires some education to get there. That's not like a 6-week course, but more like years of study and requiring some fundamental knowledge, say my profession, physician assistant. I have the fundamental knowledge of human anatomy and physiology. I have the ability to take a history, examine patients, interpret vitals in other labs, make an assessment, and then I'm allowed to, by law in California, go through with a plan, let's say a prescription or a course of therapy or a referral to higher level of care to address that patient's concern. So these are people...
So it's like an intentional education in a specific area.
Totally.
Okay.
And also people who are called to a higher level of professional engagement.
Gotcha.
It's hard to say what it is without saying the word. I mean, we all kind of know what it is.
Yeah.
Yeah. So by these definitions, all the different professions that I just listed for you, I mean, what else could you call them but define them as professionals in professional careers?
Yeah. So why are they not being professionals anymore?
So they're not professionals anymore. And I would say, what a slap in the face.
Right.
Considering how a number of these professionals were so important in the epidemic that they were called essential workers. And how these people risked their lives to take care of their community.
Yep.
So what does it mean for people who are becoming part of these professions, and what does it mean for people who are already there? Well, I don't think it means a whole lot except for the emotional reaction for people who are established members in these professions. Probably not much will happen day to day, and I don't think there'll be any change in the functioning of the jobs.
So you're still going to see patients and you'll still be a provider and you'll still be serving the community,
Right.
Even though you're no longer a professional?
Right. But it might change the way we're paid. I hope not. The administrators are saying no. But, for example, for Open Door, we're salaried. And so we're not paid by hours. So oftentimes many hours of the day are unpaid labor, just given to the community with love.
Yeah.
And if we're not salaried anymore and they can't get all that unpaid labor out of us anymore, how many of us can they afford to have there?
Well, here's my question. So if doctors are professionals, but nurse practitioners, PAs are no longer professional, we're talking about healthcare
Right.
here in our
Right.
Health Matters show.
Mm-hmm.
And we lose those professionals, especially in Del Norte County, where we
Right.
have low access or no access to medical care. How much more expensive is it going to be to have doctors doing those things? I'm assuming they get paid more.
Right. It's not efficient.
And then we don't have enough doctors.
Right.
Like we have one pediatrician for 27,000 people who live in our county. No, they're not all under the age of 18,
Right.
but a significant portion of them are, and we have
Right.
one actual licensed professional pediatrician in Del Norte County.
Yeah, we had 2, but now we're going down to 1.
And as of January, we will have none.
Oh, I think there's one at the hospital, Nazarene.
At the hospital?
Yeah.
So if you have an emergency, a pediatrician will see you?
No, an ER physician will see you, or maybe the PAs that are working in the ER.
But they're not professionals. So I'm talking about going to like a regular provider on a regular basis. We will no longer have a pediatrician.
Right. That's why this is so stupid. It's
Oh my
really
God.
going to hit rural communities. So what this is really going to affect is the students because of lower loan limits. And that's why the Department of Education is involved. So this is important for nurse practitioners who have put an emphasis on getting doctorates in nursing. And this costs about $250,000 for a course of study. So currently, a nurse in NP school can borrow up to $50,000 yearly with a cap of $200,000, and now they are capped at $20,500 yearly and $100,000 total. This isn't enough to, and probably, well,
Jeez.
I'll say a little bit later what I think is going to happen. I don't think prices are going to go down.
Well, no, they're not. They're going up.
PAs students will pay about $90,000 to $100,000 for their entire program, which makes it much more doable if somebody has to finance their education themselves. Same thing. They can borrow up to capped at a little over $20,000 with $100,000 a year total. So PAs are in school for 2 years. I still think, and PAs get paid a little bit more per hour when they come out of school. So this is really going to hit the nurse practitioners because their schooling is so much more expensive.
Are they more educated than a PA?
They are very educated people in nursing.
Yeah.
PAs are very educated in medicine.
So you said it's a 2-year program for PAs. I'm sorry, I'm going to go back to this one.
Right.
How many years of prerequisites is it for that? Or is it just...
You have to have a bachelor's degree.
Okay, so then,
It's
and then
a
it's a
master's.
continuing. Okay, gotcha. Okay.
Right. This also forces, here's what I think is really insidious that nobody's addressed. This forces the determined student to go outside of government loan programs to private lenders.
Yep.
This happened to my daughter when she went to nursing school in Drexel a couple of years ago, where she had to have her education privately financed. So
Jeez, what was the interest rate on that?
I think it was huge. I think it was around 20%.
Oh my God.
My interest rate, I thought, was huge. It was approaching 7%. It was 6 point something. Now, remember, I went to PA school in 1985, but 6%.
Well, the interest rate was huge then.
Yeah, that's huge. So her interest rate was multi-factor higher than that. So,
Yeah.
Yeah. So luckily she went into it with no student loan because her mother worked long, hard hours to make sure of that. But,
Her unprofessional now mother.
right.
Sorry, I'm just going to...
Totally.
I'm not happy about that.
But I think this is going to force students to go into predatory loan programs.
Right. Even the federally backed student loans are predatory loan programs. But
Right.
when you privatize it and you have to do that for half of your education, the repayment of that, the interest payments on that, it's... Why would anybody willingly do that?
Right. The other thing is that oftentimes people are attracted to like working in Del Norte Community Health Center. You know, it's known that providers come and go about every 2 years.
Yeah.
That's because they have a 2-year commitment after they get out of school to practice in an underserved community and to pay their student loans off, or at least partially pay them off. I don't think it completely pays them off anymore. And during that time, they're kind of like indentured servants. And so when that time limit is up, they can hardly wait to get out of that situation. And they want to go to the, like a higher paying job in a more urban area that has better education choices for their children. That whole thing about his wife wasn't happy because there was no shopping is fiction.
Right. We always blame women and they're not liking in a small town for shopping when it's
Right.
they can't educate their children. They can't have resources.
Right.
They have a lack of access to medical care.
Right.
It's all of the same things that we struggle with. They struggle with while they're here.
Yeah.
And why would they stay if this is not where they are from? They don't have their ties to here. They don't know the area. They don't know the people. And they're just getting their loan paid off. Why would they stay?
Exactly. So, who you said a couple of minutes ago, so who are the students who are affected? Well, most of these professions are primarily professions that women go into. So,
I
there
wonder
you
why
go.
we're attacking women in education.
Right. And also students of color,
Yeah.
so minority students. And this becomes a barrier to really talented people who could be very helpful in an underserved community. So they just make it not worth it anymore, not financially worth it to go into the practice, not financially worth it to hang around a rural community. And there's like no good that will come out of this. And let me tell you, let me just remind you that the one thing in medicine I learned on the very first minute that I was in school was you do not piss off the nurses.
This is very true. You
Right.
learn that as your
They will make your life
Yeah.
hell because they deserve to be the respective professionals
Yeah.
that they are. So I think this is probably going to be played out in court. So mostly they targeted professions that were majority women. I know in my PA class, remember it was 1985, but we had 42 people, 3 men, and the rest were women.
Wow.
And they were super excited that we had 3 people of color. They were like over the moon. But I
Yeah.
trained in North Carolina, so
Okay.
in 85, so the worldview was a little bit different. But it's kind of interesting to look at who is not affected. Chiropractors,
Mostly men.
yeah. Physicians kind of expect that.
Mostly men.
Yeah. Veterinarians,
Ooh, that one has slightly changed in the last 5 or 6 years.
is
It's
changing.
now it is closer to being predominantly women, but there's still a substantial amount of men.
yeah. And so I find that interesting. Like, we really need more physicians. We definitely need more veterinarians. Our community is blessed with chiropractors. But I just so enraged it's hard to talk.
Right?
So why target women? Do they really want women at home having kids? Is that the deal?
I believe so. Yeah.
Yeah, that's not going to happen.
Dependent on men, not able to support ourselves, not be able to pay for our own education, not be able to make the same amount of money.
Right. Be reproductive vessels.
Barefoot and pregnant. Yeah.
Yeah, there you go. And not have an opinion on anything because that's inconvenient, I guess.
Yeah.
But think about the people in our community who really help us. And especially, most of them are PAs and nurse practitioners. And I have a list here, and I want to shout out their names. So the first one that came to my mind was Susie Q, who works with kids behind the hospital, and we just said there's a problem with getting access to pediatric care.
Yep. Thank you, Susie.
Yeah, weirdly, Susie Q used to be a veterinarian, so maybe she can still slide in under that.
Well, children are like little animals.
I know. Dustin, and these are all, I'm using their first names because I call them one-name wonders, but Dustin, who works, is kind of exploring telehealth as his practice takes place with him in Reno and his patients in Del Norte.
Yep.
And it's all telehealth. Jesse Voss, who has been super amazing in his role as dermatologic PA.
Oh, wow.
And sometimes we have an actual dermatologic physician in town, but mostly it's Jesse. And, he's got a very thriving practice right there by the DMV, and he reaches out to our community every single day.
Nice. I didn't even know we had a dermatologist here.
We have a dermatologic PA.
Sorry.
Yeah,
Yes.
and he's the rock star. Carolyn, who is known usually as Carolyn Dykes, Carolyn Arenas. She got married, but she's pretty much in charge of the Smith River UIHS clinic, and she is out there in no ambulance land taking care of people every single
Wow.
day. With an associated dental clinic, and stuff happens during dental procedures.
Yeah.
And when I've worked there, we're called upon frequently to try and get a patient stabilized before transport to the hospital. So,
Wow.
And she does this without fear. The woman is without fear.
Nice.
Nora, who's kind of new at UHS, nurse practitioner, she was She came to us from Del Norte Community Health Center and a little bit in the veterans, who's super happy and kind of out there also in a similar situation where she's at the Klamath Clinic, only recently has had ambulance service. And yet when you're working the Klamath Clinic, somebody could come in with a chainsaw massacre or a sick kid or head lice or just come by to say hi. So she's out there
Jeez.
taking care of what needs to be taken care of, and you never know minute by minute. Shelley, who's at Redwood Family Practice, is beloved by so many people.
Yep.
And is getting ready to retire, and much to the grief of patients that she so sweetly
Yep.
refers to me if it's something I can take care of at UHS. Judy Ramsey, who's retired, was in Blundell's office for so many years. Joni Butler, also in Blundell's office in Redwood Focus Care for so many years. And Deborah Taylor, who's also out there. And then you had some people you wanted to add to the list.
I did, right? We got Heidi at Open Door. And
Heidi Wright, yeah.
Heidi Wright and Annette Carlson and Rochelle Gator.
Annette Carlson,
Annette- Yep.
a local person.
So is Heidi, born and raised.
Right.
Yeah.
And Annette,
Married Isaiah and came running back home with him and said, "This is where we're going to live."
right.
And now he's our mayor.
And Annette, who is who actually went to Yale.
Oh my gosh!
local
See,
kid went
she does
to
not even
Yale.
brag about that.
Right. And she was talking about her student loans the other day.
Oh,
and
jeez.
she could use some of this help.
Right? Oh my gosh! She could probably sell some of her art. She is have you seen Annette's art? She is an amazing artist.
Now we just talk medicine.
Oh my gosh!
We geek it up when I see her. And then Rochelle,
And Rochelle's amazing.
also kind of a local California Northwest, was born in southern Humboldt County.
Yep.
And super interested in, continuing here, but also has her eye on a couple of practices more northern. So who knows, Brookings, you might look out. It's too soon to tell, though. I hope I'm not saying secrets.
Yeah, don't be
Yeah,
don't
I'm
know.
saying secrets. So I think
So we need to make Annette
make Rochelle feel like she should stay.
make Annette sell her art and then go and love on Rochelle so she stays here with us.
Right.
Yeah,
that's
Brookings
what we
can't
want.
have her.
And then one of our favorites, who's actually mostly a Humboldt County surgical PA, but my friend Katie Schoenfeld. So Katie, who works with Dr. Palmer, who used
Yep.
to come up here and work in Dr. Blundell's office.
Oh, see, I've only ever known her at Dr. Palmer's office, and I did definitely shout out to Katie. She saved my life. Love her.
Yeah, Humboldt County. So I know her because our kids went to school together.
Okay.
We were kind of moms.
Aw.
We were the PTA moms together.
That's cute.
But you know all those people by their first names. They have stayed
We do.
here. They, in some cases, they were born here and raised here, and they have stayed here, and they are professionals in everything they do. And what would happen if all of a sudden we didn't have the next aspiring PA who looked at how that person's education, most likely, or her, could be funded, and how what they do. Do they just fold up and give it up at that point, or do they press on with something that's you don't go into this profession unless you have a dream.
Yeah,
and-
and a genuine love for people. I am just amazed
And
at
community.
right the overwhelming sense of love that you all have to do what you do every day.
Right. And these people have stuck by us more than I think, physicians that have floated in and out. And they have, I totally see them maybe practicing until, like me, until I'm 70. And then I still probably won't be able to keep myself out of the biz,
No, I don't think you will.
Yeah, to go off call, which is what we call it, to go off call would be inconceivable.
I can't imagine you going off call and not serving.
Right.
The way you do.
This community in particular.
Yeah.
So no better community to make a difference. Let these people do what their heart is calling them to do.
Absolutely. And we're going to lose that. So when we talk about the economic impacts of healthcare and doing these things, to me, I just look at this as this massive push to privatize our healthcare system. So which would mean the loss of Medicare. And I know people are like, oh no, that would never happen. That's what we're being pushed into. That right. We've already cut the Medicaid. We're doing different crazy things with Medicare, and you will see the effects of that in 27 if this continues to go this way and it's not changed and Congress leaves these bills as they are. So I pulled up some stats when you sent this over to me this morning because I was very angry. And I personally view this as an attack on women, an attack on our daughters and our granddaughters and our nieces, our little baby cousins, because they're the ones that aren't going to get to have this education. So here's the stats that I've got. Women earned 80% of all master's degrees in health and science from 21 to 22. I wonder why we are attacking them now. Women's share of doctorates by field, health and science is 66.9%. Psychology is 74.7%. Education, 73.2%. Right. Women make up the significant majority of nursing professions at 89%. Women make up the majority of physician's assistants. It's 71%. Women make up approximately 89% of nurse practitioners in the United States. 96% of all speech pathologists and language pathologists in the United States are women. I wonder why we're calling them not professional anymore and making it harder for them to be educated. Approximately 92% of audiologists. Approximately 70% of physical therapists are women. 89% of occupational therapists are women. 85% of social workers with a master's degree are women. 62% of all business majors are women. Gynecologists, only 38%.
Really?
Yep.
Oh.
It's growing. There's getting more. There's 62% of the women in school now to become gynecologists. 62% of the students are now women and going to be educated in that. 63.6% of all master's degree are earned by women in the United States. But it's still a man's world. Men make up 70% of chiropractors. 62% of all physicians in the United States are male. This makes me so mad.
I know, it's awful.
Right? So when you do the side by side, 62% of all physicians are male, only 38% are female. The ratio for female to male dentists, 65% are male and 35% are female. The ratio of men to female podiatrists, 74% are male and only 26% are female. Approximately, and this one gets me, approximately 87% of the paid clergy are men. Guess how much, what the percentage is of women who do the lay ministry and the unpaid work within all religions in the United States?
Oh, give it to me. I know.
70%.
Wow.
80% of those who work in the ministry who are paid are men, and all of the unpaid labor, or 70% of the unpaid labor, is done by women. And it really got to me. So we've talked about this before. I was raised a Christian conservative Republican. I served a mission for the Mormon Church in Columbus, Ohio in the late 90s. I was asked by the Democratic Party to switch parties and to be with them on their central committee and to help address some of these things. And so I did. So as my Christian conservative Republican self, I want to share a scripture with everybody. It's Galatians 3. There is neither Jew nor Greek. There is neither bond nor free. There is neither male or female, for we are all one in Christ. If we are all going to be one, we have to stop allowing the dismantling of our education systems, of the opportunities for women, of minorities, of all of these things that we're doing, the attacks on our LGBTQIA plus communities, on our Native communities, on taking back Native land. Again, we've This has gone through the courts multiple times. It's their land. It's their land. All of these things that we are doing over and over and over again to dismantle our Constitution, to dismantle our institutions, and to do these things to enrich rich people, to make them richer by privatizing our education, by privatizing our healthcare, and doing all of these things, by adding that interest to you, to me, to our children, to our grandchildren, to our nieces and nephews. We are simply making billionaires into trillionaires. It just boggles my mind how people do not understand this and they cannot see this. As our small businesses close, as our neighbors are no longer able to purchase health insurance on the exchange because it's unaffordable and cannot operate their business anymore, and then have to go and work for private companies. So our small businesses, our entrepreneurs, our families, all of these things that are going to take place within our community are wretched and horrid, and they will take place slowly at the end of this year, at the end of 2026, into 2027, and some of these things will take place in 2030. And it bothers me immensely when we have people that simply say, well, it doesn't affect me, so I don't care. We have to stop voting party line. We have to stop just saying that's an R and I'm going to go for it. It's ridiculous. We are voting against our own interest every election cycle in Delmark County.
Matter.
Votes matter.
Consequences.
They matter. If they didn't matter, you wouldn't hear somebody in particular saying that every time he doesn't like the outcome of a vote, that it was stolen, that there was fraud. I wonder why. If he wins, there's no fraud. But if he loses or he doesn't like the vote outcome, then there is immense fraud. We just have to open our eyes. We have to pay attention, and we have to take these things on. So what do you think, since I'm going to get off my soapbox and my tirade here, what do you think we can do about this?
Well,
Ooh, okay.
excuse me. I think actually, Joe Average Del Norte should probably be writing to federal senator, federal House of Representatives, and also to the head of the Department of Education.
Do you think McMahon cares? She's the head of the Department of Education.
Somebody cares, and I think she's, TikTok baby. I think she's going to be out soon enough. But as a professional, I'll tell you what I'm doing. I'm going to our professional organizations and I'm saying stand up against this. I don't know how they couldn't have seen this coming, but because apparently it was in Project 2025.
Yeah.
But I'm going to the California Association of PAs. I've signed petitions that are associated with the American Association of PAs. And right now I'm asking for a position statement. I'm kind of saying that I'm a press person. So I want a position statement from the National Commission on Certification of PAs.
Good for you. Use your Redwood Voice email.
That's right. So I'll tell you what that gets me, but that's what I did immediately, for the half hour after I saw this.
Yeah, I'm just flabbergasted, and we are running low on time. If you have it within you, if you have capacity to write to your senators and to your Congress people, or write to the other ones in other states too, since ours are not supporting such BS.
Right.
This is just insane to me. It's absolute insanity. And the loss of the Republican Party and how we have capitulated and given up our beliefs and our values and the things that we hold dear. The capitulation to this man is just so bizarre to me. The billionaires are not for us. Right. They are not for us. They will rob us blind. They will take everything from us and destroy our homes and our families and our communities.
Absolutely.
So they can have another yacht, another private plane, to buy another island.
Yeah, it's like squirrels trying to get nuts for the winter. They don't even know that they have way more than they ever are going to need. It's awful.
Yeah. Stop supporting billionaires becoming trillionaires.
Votes matter.
Votes matter. All right. Thanks, Lynn. Appreciate you being here.
Right. Thanks for your part in this.
If you'd like to listen to this episode or any episode of Health Matters for a second time, you can go to the KFUG Community Radio YouTube channel. slide down and select the playlists, and then you can search for any episode that you like on the Health Matters because you have 7 years worth, you unprofessional you. See you next week, Lynn.
Watch me. Just watch me.
Thank you.